Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Real glad that you could join us for another segment. Going to have a conversation in this segment with Mr. Remington Walls. He's a 19-year-old sophomore at Valdosta State University in Georgia, and he's going to talk about living with a chronic allergic inflammatory disease known as Eosinophilic Esophagitis. It's also known as EoE. What exactly is this condition, and how long have you been living with it?
The way I explain it to people is it's a disease that enables me to eat. What I have, my esophagus are called eosinophils, and when I eat food, they see the food as white blood cells, and then they attack the food. Even when the food is gone digested, the eosinophils continue to attack the esophageal wall, which could cause severe ridging and scarring, which could eventually cause my esophagus to close if I continue to eat over a repeated period of time.
You're in college. How long have you been dealing with this?
I was diagnosed and taken off all foods at 4.
The age of 4, you were taken off of all food. So to your knowledge, how was it diagnosed and what causes it? I'm not real sure what causes the disease, but I just know that the way they found out is I was really sick as a baby. Mm-hmm. I went doctor after doctor and ran test after test until a doctor back home said he thinks it looks like EoE. And then I had my first endoscopy, and then he thought that I was, and then we were recommended to Cincinnati Children's Hospital in Cincinnati, Ohio. That's the head research center for eosinophilic disorders, and then my family and I flew up there, and I had a scope there, and that's when I conclusively saw that I do have it, and then the doctor made a decision to pull me from all foods. Obviously, not being able to eat food. I mean, you're 4 years old. You're pretty much at home with your parents and your family. What about school, elementary school, middle school, high school? What was that like?
It was no different than when you were in high school or everybody else was in high school. I was raised to go about it as the only thing you can't do is eat. I never looked at myself as disabled. I just had a different hand dealt to me, and that was what I had to live with.
As far as extracurricular activities, did that limit you greatly, or were there things that you could do even though you couldn't eat regular food?
No, ever since I was little, I've always done everything I put my mind to, no matter what it was, A lot of people have it a lot worse than I do. And, I always look at myself as blessed. I can do everything everybody else can except eat.
So when you're training for whatever it is that you're into, the lack of regular food doesn't do anything as far as muscle mass, nourishment for competition, anything like that?
No, nothing. I'm real close to nutritionists up in Ohio, and calories are calories. So as long as I get the calories in my nutrition, it's the same as you getting your calories from food.
Is this an extremely rare condition, or is this something that is pretty well known?
It's starting to get more well known, but the percentile that I'm in with this disease is extremely rare. I'm in the 0.1 percentile of the disease, to where I can't have any food.
There are some people that have the same condition as you, but at some point they are able to eat regular food of some type.
Right. There's a lot of people that have it, but they have, some like 20 foods, 30 foods, 40 foods in their diet. Mm-hmm. And then the rare case like mine where I can't have any.
What about the food that you do eat? These are they nutritional drinks like a shake or?
You're talking about my formula?
Yes.
Yeah, it's amino acid based nutritional formula that has all the nutrients that I need in order to survive and thrive.
Now, you said that you had your own nutritionist. Is this something that they have formulated specifically for you, or is what you eat normal across the board for people with the condition as severe as you have it?
No, the formula that I'm on is designated for people with this condition that I have. So anybody that has this disease or any sort of disease related to EoE, they're put on this formula or they're fed through a feeding tube.
Now, is there any drug therapy involved with your condition, or is it simply just refraining from eating solid foods?
There is drug therapy, but I've never participated in any of that. Mm-hmm. So I just don't eat.
Now, did you not participate because it was not necessary, or was it a choice that you and your physician made together?
It was a combination of both. I never want to. My body rejects a lot of medicines, and I've never wanted to put something into my body that I wouldn't know how it would react.
Now, you being diagnosed at 4, is that the norm? Were you say you consider yourself blessed. Was your diagnosis at such an early age the key to your healthy living now?
I'd say the key to my healthy living right now is the way my parents raised me and brought me up to look at the disease. Everybody's hand in life is different. You can't control. There's just certain things in life you can't control that happens to you. And this is obviously one of them.
When you're out doing, what you do as a college student, your social life and things of that nature, are you always around people who understand your condition? Well,
every new social setting that you go to where you don't know anybody is always a different roller coaster. Like when I first came to college, I came to a different state, different city, and nobody knew. So having to adjust and get used to everybody was no different than it always has been for me. I've been through it so much in my life that it's just kind of normal and usual and easy for me. And explaining it to people is easy, and everybody accepts and understands.
And what about support groups for other folks that you've met who are suffering? Do you meet others few and far between, or do you know about support groups, support resources for your condition?
The nonprofit organization we work hand in hand with has support groups. We've never really participated in them. We have people reach out to us from all over the world and ask us for advice on, their child has just been diagnosed, or they've just been diagnosed and they just want help or advice. So that's something we do on a regular basis. But as far as support groups go, we never really participated in something like that.
When it comes to health professionals, what would you say to someone or someone's parents who may not understand what they're going through? What questions should you ask a physician who may not be as insightful as yours was?
I would say if you're unsure of your diagnosis and you think you might have EoE, to just get in contact with Cincinnati Children's Hospital, the Eosinophilic Esophagitis Research Department. They've helped us immensely throughout my whole life, and they have a wealth of knowledge as well as so does a lot of other experienced doctors across the U.S.
Well, Remington, thank you so much for joining us here on Health Professional Radio. It's been a pleasure talking to you.
Yeah, thank you so much for having me.
Great, man. Take care and good luck, all right?
All right, appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.